Hello everyone, my name is Alimat Adebiyi. For my video presentation, I will walk you through my summer internship project at the UCLA Center for Health Policy and Research. For my project, I examined the impact of immigration on breast cancer screening among foreign-born blacks and native-born blacks in California. It is important to track the health practices, disease patterns, mortality rates among different ethnicity and immigrant groups. Immigrants are more likely to be diagnosed with diabetes, heart disease, and cancer. This is problematic because we're not directing our resources towards preventive care. Also, tracking the health of immigrants helps provide tailored care services to the needs of various immigrant groups. Why cancer? Breast cancer is the most commonly diagnosed cancer in the world. Women in America have a 1 in 8 chance of being diagnosed with cancer during the course of their lifetime. For Black women in America, it is especially problematic because they have one of the lowest incidence rates of breast cancer but the highest mortality rates. Currently, statistics report that a Black woman is likely to be diagnosed with breast cancer at a chance of 122 per 100,000, while a white woman is likely to be diagnosed at a chance of 130 per 100,000. There are various theories that have been posited as to why Black women are actually dying at a faster rate of breast cancer. This include Black women have less access to mammography screening services, or access to healthcare services are just pretty non-existent for this group, or the fact that Black women are diagnosed at a later stage, and this is problematic because the tumor burdens are much higher and survival rates are definitely lower if you are diagnosed at a lower rate. To tackle this task, I analyzed the data from the California Health Interview Survey. The California Health Interview is fantastic because it is representative of the California population and it contains vital information on demography, immigration status, and the overall health of the population. For my study, I used data pulled from the year 2007, 2009, and 2011. In total, I was able to use the results collected from 3,396 respondents. The variables that I chose to examine were demographic information, current insurance status, usual source of care, and being screened for a mammogram during the course of one lifetime. My significance level was set at 0.05. Upon conclusion of my analysis, the results from my data show that immigrant women are definitely younger in age than the native-born population. And also, women who were born outside the United States were less likely to be insured and reported lower rates of mammography screening. This is not surprising. Results from the data show that 87% of citizens who were over 40 reported that they were screened for breast cancer at some point during their lifetime, while only 76% of non-citizens reported that they had been screened for mammograms. Unfortunately, the grouping of Black women as a homogeneous group fails to recognize that a subpopulation in the Black population is actually doing much worse. Essentially, the take-home message from the results is citizenship matters, acculturation matters, and undocumented status matters. Citizenship matters because current research continues to show that a woman who has citizenship status has more access to healthcare services. Acculturation matters because the longer a woman resides in the United States, the more she's familiar with the healthcare service system, and the more she's able to go seek the care and the help that she needs. Also, any talk about immigration without talking about the undocumented status of some of these immigrant women is failed, because many of these women are unable to seek the care they need due to their undocumented status. How do we tackle this problem? How do we solve this problem? Because living this problem without essentially figuring out a way to ensure that women, regardless of their immigration status, have access to mammography screening means that we're going to be spending more money treating breast cancer instead of preventing it. And to do so, we will look at some of the recommendations that have actually worked for the African American population. Researchers have shown that church-based interventions targeted towards African American women actually do a pretty well job ensuring that many of these women are aware of breast cancer screening. While the immigrant Black population, not much research exists on them, we also know that a lot of these women rely on organizations to familiarize themselves with the American system. It is in our best interest to actually go to these organizations, partner up with them, and ask for us to learn about ways that we can teach them about the importance of breast cancer screening. In addition, while the ACAA has done a wonderful job in ensuring that a well woman care visit provides free mammography screening for many of these women, The undocumented status of many of these foreign black women prevents them from doing so. So it is also in our best interest to continue to partner up with FQHCs to provide services such as mammogram screening for immigrant population until we find a solution to being undocumented. Thank you for your time. Have a good day.